Hello, my name is Molly Smith. I'm a nurse practitioner and student with Texas State. I'm working with Dr. Miller. If it's okay, I'm going to go ahead and do a health history on you.
Okay.
Okay? Tell me what brings you into the clinic today.
Well, I've had this really bad sore throat, and like these white spots in the back of my throat.
Back your throat. Okay. How long have you been having those symptoms?
Probably about 2 days.
2 days. Can you tell me about your sore throat?
It's real dull and dry, and it feels like something stuck in my throat.
Okay. Any additional symptoms you're having?
I've had like a low fever. I think I've only got up to like 100.
Fever.
And I took some Tylenol and went down. I've had like a dry cough
Okay.
and a little shortness of breath.
Okay. So with the cough, anything productive at all?
No.
Okay. And the shortness of breath, is that just recently? Do you have shortness of breath ever?
Well, I had asthma as a child, but it went away.
Okay.
And then sometimes when it's cold or when I work out real hard, it comes back a little bit. I have some shortness of breath.
So you're not using an inhaler for that?
Mhm.
Okay. So have you done anything to relieve the sore throat? Have you tried anything?
I tried like some Motrin, some cough drops,
Okay.
things like that.
And not helping too much?
No, it's just getting worse.
Okay. Have you had the flu shot?
Mm-hmm.
Okay. And are you a smoker?
I'm a social smoker, maybe like a pack a month.
Okay. Do you have your tonsils still?
Mm-hmm.
Okay. So you're here for sore throat, a little bit of a cough, a fever, and some shortness of breath. Okay. Well, let's get some medical history so we can get some more information.
Okay.
Any surgical history that you have?
Just my wisdom teeth.
Wisdom teeth removal, no complications with that? Okay. What about for your medical history?
I have a baby. I had delivered in 2011.
Okay, that was a vaginal delivery?
But not really maybe some seasonal allergies.
Okay, seasonal allergies. With your delivery, it was no complications with that, no
No.
blood transfusions? Okay. And seasonal allergies. Are you allergic to anything?
Just apples.
Apples, okay. What does that do?
It makes me break out in like this rash.
A rash,
hives.
okay. Any medications you're taking?
Just Tylenol, Motrin, for pain, some Benadryl or Zyrtec for allergies.
Not regularly?
But no prescriptions.
Okay, no prescriptions. So any changes in your mood, history of depression, postpartum depression?
Mm-mm.
Okay. All right. How about family history? Tell me about your mother's side.
My mom, she has asthma as well. She still uses an inhaler, I think. She's like around 60.
Okay.
My dad, he's a couple years older than her, and he has high blood pressure and high cholesterol.
Okay. What about your grandparents?
Well, my mom's dad, he died of liver failure, I think.
Okay.
Really young, he was like 68. And then my mom's mom died of breast cancer at 65, so they both died real early.
Okay. So any diabetes or hypertension on the maternal side?
No, I don't think so.
Okay. And what about your, I'm sorry, did you tell me about your dad's grandparents?
No, my dad's grandma, she has diabetes, but I think it's type 2. She's like 70.
Okay.
And his dad died of cancer, but I don't know what kind. He was like 71, and he had high blood pressure.
High blood
Like
pressure.
my dad.
So a little bit of hypertension on your
Mhm.
dad's side. Okay. Any siblings that you have?
I have a sister and a brother. My sister doesn't have any history.
Okay.
She's 28, and then my brother is 34, and he has high cholesterol, but he doesn't have high blood pressure.
Okay. All right. So for your social history, what do you do for a living?
I work in human resources at a hospital.
Okay. Are you married?
I am.
Okay. And you said one child?
Yes, he's
Okay.
3.
3. Oh, congratulations. Any religious preferences, cultural practices that you want me to know about?
I'm Christian.
Christian. Okay. All right. Well, let's go ahead and just review how you've been feeling generally. Any weakness, fatigue, tiredness?
Yeah, I've been real fatigued and tired
Okay.
this week.
Last week. Have you been getting the normal amount of sleep?
Yes.
Okay. Any fluctuation in your weight that you've noticed?
No.
Okay, and you have a little bit of a fever, you said.
Mhm.
Any numbness, dizziness, tingling in your fingers?
Mhm.
Okay. No history of major falls,
Mhm.
and you said no changes in your mood. Any headaches? Blurred vision,
I
dizziness?
occasionally get headaches. No, nothing different.
Okay.
They go away with
The
time.
Tylenol, okay. Do you wear glasses or contacts?
Yes.
Yes.
And the glasses.
Okay. Any dizziness, or I'm sorry, not dizziness, any blurred vision, spotty vision?
My eyes get real red and itchy with my allergies.
Okay, just with allergies. Okay. Any pain in your ears, hearing problems?
No.
Okay, you never had tubes placed as a child? Any runny noses lately?
A little bit.
A little bit clear drainage though,
Mhm.
nothing yellowish? Okay. So you have the sore throat, any hoarseness in your voice at all?
No.
Okay. And no productive cough?
No.
I'll take a look at those white spots in a little bit. Any cuts or sores in your mouth that you know of? And you have your tonsils. Any history of gum disease, any bleeding? Okay. Have you noticed any swelling or bumps on your
A
neck?
little bit in my neck. It feels
Okay.
kind of swollen and sore.
Okay, I'll check that out in a minute. Any rashes, bumps, sores on your skin? Okay. And no bruising easily?
No.
Any moles that you've noticed that change?
No.
Okay. Any muscle aches, pains, cramps? Any stiffness in your body?
No.
Okay. And you have pretty much full range of movement, you feel like? Any chest pain, history of cardiovascular disease in your family?
No.
Okay. Any feeling that your heart is racing or it skips a beat? Okay. Do you have any of your shortness of breath while resting?
No, it's just mainly when I exercise or when it's real cold outside.
Okay. Let's see. Okay, so have you ever had tuberculosis or bronchitis?
No.
Okay. Does it hurt to, when you inhale, take a deep breath?
No.
No? Okay. Any stomach issues, nausea, vomiting?
No.
Any change in your bowel habits?
No.
Okay, any heartburn at all?
No.
No blood clot history, varicose veins,
No.
swelling in your lower extremities?
No.
Okay. Any burning frequency of urination?
No.
Okay. Any cloudiness or lower back pain? Do you have regular periods?
Yes.
Okay. And do you know your last pap smear when that was?
It's like 3 months ago maybe.
Months
It was
ago.
normal.
Do you do self-breast exams?
I do.
And no lumps, discharge, or pain that you've
No.
noticed? Any history of bleeding disorders?
No.
And you said you've never had a blood transfusion. And any, have you ever been told you have thyroid issues?
No.
Okay. And no heat or cold intolerance?
No.
All right, well, let's go ahead and do a physical assessment.
Okay.